This is a question for Dr. Walensky. I've been talking to epidemiologists, and one of their concerns is that the CDC's masking policy lacked teeth, so most people just took it to mean they didn't need to wear a mask at all. San Francisco is now contemplating requiring proof of vaccination to get into bars and restaurants. Other people have suggested that masking regulations change if cases go above 5 per 100,000. Are there any thoughts in the works of either clarifying or changing CDC's masking policy?
Thank you, Elizabeth. As we have said consistently, the greatest risk right now is to those who are unvaccinated. And we have consistently and repeatedly said, if you are unvaccinated, you need to be wearing a mask to protect yourself and others around you. And we need more people to get vaccinated to stop this pandemic. So overall, the CDC recommendations haven't changed. Fully vaccinated people are protected from severe illness. And we've always said that communities and individuals need to make the decisions that are right for them based on what's going on in their local areas. So if you're in an area that has a high case rate and low rates of vaccination where Delta cases are rising, you should certainly be wearing a mask if you are unvaccinated. If you are vaccinated, you get exceptional protection from the vaccines, but you have the opportunity to make the personal choice to add extra layers of protection if you so choose.
There was this report overnight about the White House discussing masks, discussing mask mandates in light of LA County's decision and the rise of the Delta variant. Can you tell us whether that report is correct? Is the White House, in fact, having high-level discussions about that?
So on masking, I think you just heard a very strong summary from Dr. Walensky, and that's where we are. We will follow the science, and public health guidance is made by Dr. Walensky and her team at the CDC. So we will continue to follow the science and follow CDC on mask guidance or mask recommendations.
Thanks so much. Dr. Walensky, I just want to circle back on this just so we have complete clarity. Is the CDC considering right now changing its mask guidance for people who are fully vaccinated?
We are always looking at the data as the data come in. Our guidance has been clear since we put it out several months ago, and that is if you are unvaccinated, you should continue to wear a mask and protect yourself against others around you. And more importantly, you should go and get vaccinated to get better layers of protection. We have always said that local communities have to look at what is going on locally as we have very heterogeneous country right now. In areas that have a high amount of disease and low amounts of vaccination, that, if you're unvaccinated, you should absolutely be wearing a mask. If you're vaccinated, you have exceptional levels of protection from that vaccine, and you may choose to add an extra layer of protection by putting on your mask, and that's a very individual choice. That has been consistent with our CDC guidance since we put it out.